Hello guys, how are you doing? What's up people? I'm sure you guys are taking good care of your health, right? My name is Evelyn Awele. I'm a pharmacist, and today I just want to talk about tests to be carried out by every woman. Now this video is not just to women alone. If you have a wife, as a man, if you have a wife, a girlfriend, you have your mother there, your siblings that are girls, so this video is also for you, just for everyone in general. Now, what are the tests you need to be carried out by every woman? When you get to a particular age, you have to be cautious about your health, right? You have to be very, very cautious about your health. Now, let's start with number one, the blood pressure. You need to monitor your blood pressure. I get this a lot, that people say, oh, because they've not got to a particular age, or they're not old, then they don't need to check their blood pressure. As we all know, that blood pressure can be a silent killer. And when I mean a silent killer, you don't even know. There might not be signs and symptoms of this high blood pressure. It happens to you suddenly. So you need to monitor your blood pressure. If number one, you are diabetic, if you are overweight, if you have a family history, and also if you have a high blood pressure during pregnancy, you need to check your blood pressure. You do that every year as often as possible. So if you're at risk, meaning if your family have a history of high blood pressure, then at an early age you need to check your blood pressure. Then number two is breast cancer screening. So apart from the regular self breast examination, you also need to speak to your healthcare provider, your physician, who can give you other option for this kind of examination. Then thirdly is cholesterol screening. People don't do this all the time, but when you get to age 45, you need to screen for cholesterol. You do that, especially if you're not at high risk. At age 45 is still not bad, but if you are at high risk, you need to check as early as from age 20. You screen for cholesterol. You do that every year too. Then the fourth is cervical cancer screening. Now this test should be carried out from age 21. Now, between age 21 to 29, a pap smear test needs to be carried out every 5 years. But if you're from 30 and above, you carry out your pap smear test every 3 years. Then the HPV test, which is the human papilloma virus test, needs to be carried out once every 5 years. Or you can do a co-testing with the pap smear and the HPV every once every 5 years. So as I said, for cervical cancer, this is very, very important, because apart from breast cancer being the number one type of cancer that actually affects women, cervical cancer is also rising, and Nigeria is not an exception. So you need to screen for that too once you are from age 21 years. Then there are vaccines available for prevention, for our female kids from age 9 10 years. They can give a vaccine for that. And lastly is diabetes. You need to screen for diabetes, especially if you are from age 35 and above. You screen for diabetes, and if there's no risk for you coming down with diabetes. But if it's in the family, it's called family history, and you know that you have a high chance of coming down with diabetes, you start to screen prior to that time, right? Let me reiterate. I said the 5 tests to be carried out by every woman include: number one, blood pressure. We have the cervical cancer screening, cholesterol screening, breast cancer screening, then lastly, diabetes. These are 5 important tests to be carried out by every woman. So thank you for having these few minutes with me. I hope this information is very, very helpful to you out there. Thank you.